So, hi John, I'm glad you could make it in again today. I wanted to briefly go over the results of the assessments that we gave you and just give you some information about what we found and what the next step is. Let me first say that I want to make sure that if you have any questions during my results, just feel free to stop me and ask any questions. And also I wanted to let you know also that the assessments don't mean that there's something wrong with you or that there's an issue. We just want to make sure, myself, that we're paying attention to any needs, or we're addressing any needs that you may have. So I first wanted to say that the scale did show, the assessment results were that you are suffering from some severe depression, and that there is some moderate to severe hopelessness and anxiety, but that you show that you're low on suicide ideation. So these are just the preliminary or cursory results of the assessment. We may revisit the assessments later on or retest just to make sure that we didn't miss any possible signs. Now I do show that with the suicide ideation that you may have tested, the test results may have been skewed just because of your possibility of not understanding fully what the test results, the questions were, or how you should answer the questions. And also I wanted to also retest you to make sure that you were comfortable with taking the test and understanding that being fully honest and open about your feelings and what is bothering you will help me to help you get better and to move past the issues that you're having with depression. But because of the suicide ideation that I feel like may be an issue with you, I do want to recommend that we do a short-term inpatient observation of 3 to 5 days, just so that I can get you in a more isolated area and be able to really observe you and maybe have the help of some other colleagues to make sure that we're not missing any of these. This isn't anything that you have to do or you're required to do, but I would strongly urge you to, because I do want to make sure that we're not missing something or that there is more trouble that we're actually seeing on the surface. So after that, I would recommend that we do continue our sessions weekly, the one-on-one sessions, to make sure that we are addressing any issues from the past and going forward. Did you have any questions for me at all? Okay, thank you. Let's get the paperwork started.